So you've recently undergone surgery on your face, and you've got some stitches on the face, and you've also got some tape on your face, what we call steri strips. Okay, the care for this is pretty simple. The steri strips, the surgical tape, are on your face to hold the ends of the sutures out of the way so they don't bug you. Okay, so that they're not flopping around in your eye or in your nose or whatever other part of the face, so that you're not tempted to scratch at them or flick them out of the way. Because the more you manipulate them, the higher the likelihood that the wound is going to pop open, and the higher likelihood that you're going to get a wound infection. Okay, so we put the tape on there to hold it out of the way. Please, please, please do not remove that tape until it's time for the sutures to actually be removed. The tape comes off at the same time that the sutures come out, okay? And that'll be somewhere between 10 and 14 days after your surgery, depending on which part of the face it is, okay? Those sutures can be removed by me or somebody here in my office, or they can be removed by your primary doctor, depending on where you live and whether or not your primary doctor is comfortable doing that, okay? Alternatively, if you know a surgeon who's comfortable removing these sutures when it's time to do so, and the surgeon's willing to do so, I have no problem with that. Okay, it is important during the healing process to not apply any ointments or alcohol or hydrogen peroxide or anything like that, particularly to the steri strips, because it will break down the glue and cause those steri strips to come off. Okay, if you have sutures above your eye, don't put any ointment on that unless I prescribed it for you, because the ointment will then leak into your eye and it'll be really uncomfortable. You won't like that. If it's on other parts of the face, it's okay to put A and D ointment on those sutures as long as it doesn't get on the steri strips, okay? But you should definitely not use Neosporin or hydrogen peroxide or alcohol, because all of those things can cause other problems with healing. The Neosporin in particular can increase the risk of a fungal skin infection, which can be very difficult to treat, and the alcohol and the hydrogen peroxide and other things like that actually slow down healing. And what we're trying to do is promote healing. So I'd recommend, if you have any concerns or questions, reach out to us. Okay, we're happy to answer those questions for you. But keep in mind that the steri strips are designed to hold the sutures out of the way so they don't bother you. Okay, and there's a special glue holding them in place. If you find that those steri strips are starting to fall off early, you can reinforce it with a Band-Aid or with some tape. Okay, I don't recommend duct tape or Scotch tape. You know, you can use some medical tape to hold that in place if the steri strips are falling off prematurely. Or you can go to the store and buy some steri strips. Okay, again, don't put any ointment unless I prescribed it for you, other than maybe some A and D ointment if it's on parts of the face that aren't above the eye. Okay, if it's above the eye, don't put anything on it unless I prescribed it, because we don't want that stuff getting in your eye and causing problems. Additionally, it's really helpful if you sleep with your head elevated on 4 or 5 pillows for the next few weeks after surgery. That'll decrease swelling, which will then in turn improve healing and also decrease any soreness or throbbing. Okay, so don't lay down flat. Laying down flat will cause a lot of swelling. It may cause some significant discomfort. Okay, that's all a natural part of the healing process. It doesn't mean you have an infection. It just means that you laid down flat when it was too early to do so.